I come to Novocur because I had been experiencing, for one, I was diagnosed with fibromyalgia, and I've been having a lot of issues just not being able to function. And I'd have episodes where I was down for at least 72 hours every other week. And you know, I wasn't getting the results from my own doctor that I really wanted, and I was really tired of all the medications I was taking. I came in, my first initial visit with Dr. Thacker was amazing. I mean, just the way he had empathy for me and the way he listened to me, it was so much better than what my own doctor cared.
If you're one of the countless millions of Americans who suffer from low back pain, you don't have to suffer anymore. I'm with Dr. Neil Thacker over at Novocur Pain Management Clinics, or one of the clinics, by the way. And Dr. Thacker, let's talk about Shelley, a patient that actually frequents the pain management clinic. Tell me, what is her main problem?
Well, Shelley has low back pain, but more specifically, her pain is coming from her sacroiliac joints, which are the joints that are lower on the back. Sacroiliac joint pain accounts for actually 30% of all low back pain, so it's a pretty common issue.
Yeah, and Shelley certainly shared how she feels on a daily basis. So talk about some of the treatments that she's had and why she keeps coming back.
Well, sacroiliac joint pain comes from arthritis and inflammation of the joints. So basically what the best treatment is to do an injection into the joint of an anti-inflammatory medication mixed with some numbing medication to give some instant relief. So that's what we've been doing with Shelley. She has pain on both sides. There's two joints in all of our bodies, and so we've been injecting each joint with some anti-inflammatory medication.
Now, how is that different than other types of treatment that someone may be trying right now that's just simply not working?
Well, it depends on where the back pain is coming from. A lot of people's back pain comes from the spine, comes from a herniated disc or other arthritis in the spine. A lot of times sacroiliac pain can be misdiagnosed as pain that's coming from the spine, and it can be missed. So it just takes a proper, physical examination and listening to the patient and what they complain about to diagnose it.
So here at Novocur, how do you guys diagnose it? How do you really pinpoint where the problem is?
Physical exam is very important. That's probably the key to the diagnosis, as well as a good thorough history. A lot of the sacroiliac pain, it starts in almost in the buttocks area, and it can radiate to the hips as well as down the back of the legs up to the knee. But it all stems from those two joints. So these injections help a lot.
And do you have to have some sort of, I know that Shelley mentioned she has fibromyalgia. Are there other types of problems that would cause this type of pain, or could it be something from as simple as just overuse?
Overuse is the biggest reason. A lot of people actually who have had back surgery on their spine, and that problem is fixed, will have back pain afterwards. A lot of those patients will think, oh, the surgery didn't work, but in fact, sacroiliac pain can come as a result of low back surgery a few years afterwards. There aren't really too many good surgical options for this type of pain. There's a lot of surgical options for pain in the spine, but not really for sacroiliac pain. So what we can do is at least decrease the inflammation within the joint and see how long that these injections last. And if they don't last a long time, there's actually another procedure that we can do afterwards that can give them more like 6 to 12 months of relief.
I still have episodes, but it's not to the point where it takes me down 72 hours every other week. I'm still able to function. I'm able to get up. I sleep better at night. I can actually be at work, and I'm not losing anything. The quality of life that I've had with my family alone is amazing. The shots, the injections that I've gotten, it honestly has given me my life back. Even though you hear that a lot, it really truly has, and it's amazing. And I'm excited to come in. I'm excited to see what's going to happen and how much better off I'm going to be.
Well, here's more information on how to find Novocur Pain Management Clinics. They have 2 locations in the Valley. For more information, you can contact them at novocur.com or call them at 480-855-NOVO, which is 480-855-6686.